Hi, my name's Michelle Gellis. I am an acupuncture physician and I teach facial and cosmetic acupuncture classes internationally. Before I get started with today's lecture, I wanted to talk really quickly about a book that I've just written. And the name of the book is Treating the Face. And um, it is a 500-page hardcover book with over 350 color illustrations, all about treating the face, uh, everything from neurological conditions to some five element and also cosmetic. So, if you can go to the first slide. Today, I am going to be doing part two of a two-part lecture on how to choose safe and effective cosmetic tools for your treatment space. So last time I did an overview of some tools and I went through some safety. And today I am going to talk about some practical considerations, things like ease of use and functionality, how to match tools to different skin types, and then how to set treatment goals, and also how to integrate different technologies using these different tools into your treatment space in order to get the best results. So the first thing I'm going to talk about are microneedle pens. And um, I have a microneedle pen here. And the microneedle pens, when you're thinking about ease of use, microneedle pens are great. They typically, you want to look for ones that have both a battery that you can use or a plug that you can use. And also, you want to be able to adjust the depth of the needles. So you might want to go to me for this. So these needle cartridges click on, and then there is a little adjustment ring here where you can adjust the depth. These numbers uh, signify the depth of the needles on the how deep the needles will go. And then on this particular model, this is an AccuLift micro pen. On this one, the this end shows you how fast. It says number 4. Sorry, trying to catch the light here. So you just adjust, you push the, whoops, this way. You push the button on the top, and then it lets you know how fast the needles are going up and down. So you can go back to the slides. So you want a pen that has an easy to use dial for your depth adjustment. And that way, when you're working in different areas of the face, neck, chest, hands, back, any parts of the body, you can adjust the needle depth. And then having it either be corded or cordless gives you some versatility. And lightweight pens, if you're doing a lot of microneedling, you don't want something that's too heavy in your hand. And really simple cartridge adjustment. So the needle cartridge, you should be able to click it in, snap it on, and make sure that it's something that will stay securely attached. And replacement parts should be easy to get as well. Just like with any electronic device, batteries can wear out on these over time, over years, and being able to get replacement batteries, cords, things of that nature is very helpful. So derma rollers, you can go to me again. This is a derma roller, and they have this head. You want to get one with a smaller head that'll fit in smaller areas. And I like the ones that have needles that are shaped like little pyramids. They tend to not bend as easily, and these are actually integrated right into the head of the derma roller. And the handle has a design that makes it easy and comfortable to grip, to get a good grip on it, and to hold in your hand. And these have 540 microneedles on them, and they come in different lengths. These are also made by AccuLift. You want to make sure that any microneedle device that you have comes in a nice case to keep it clean and that it's pre-sterilized. You can go back to the slide. The nice thing about derma rollers is they perform a lot of the same functions as a microneedle pen, but they don't require any batteries. You just take it out of its case and you don't require any numbing cream. You just roll it on the face and you can rinse it after you use it. They are for single person use, but you can use them over and over again, and then you can sanitize them once a week just to make sure there's no bacteria or anything on them. You can go to the next slide. Let's see if I can do that. Hydra needles and Hydra rollers are very similar. Can you go back to me again? And these are great because, so this is a Hydra needle. You could see, let me see if I can get those needles up there. Tiny little needles right in the tip, and it has a plunger. And when the plunger is depressed, serum comes out of this glass vial. So you press it on the skin and it's infused into the skin, whereas the Hydra roller, which is very similar, has these gold needles on it also, but this one you roll onto the skin. So these are great. They're very versatile. You can fill them. They have a cap to keep the contents from evaporating, and you can travel with them, which is really nice. Okay, you can go back to the slide. So just make certain whichever products you choose have steps and instructions, and again, they don't require a lot of pressure. The needles are very short and they travel well. Facial cupping sets are also wonderful. Oh, I'm using mine to hold my computer up. Hold on one second. Let me grab the cups. This is funny. I'm just gonna grab these out, and so this particular set comes with 2 cups of 2 different sizes, and 2 cups and a larger one and a smaller one, and then 2 jade gua sha tools. And the facial cups are really, I like the ones that are glass, and they're easy to use, they're easy to clean because they're glass, they glide well. And so these are things you want to look for. Also, they should be easy to squeeze. You don't want to get facial cups that are too stiff or too hard to squeeze. And these smaller glass cups fit well on the face. with the gua sha tools, jade is certainly preferable to a lot of times they'll be plastic or synthetic, or I've even seen metal ones, really not designed to be used on the face. They can cause um, injury. You don't want to cause any redness or pain when you're working on the face. You don't want to leave any cupping marks when you're working with the cups, and that's where the glass is really unique because it will glide and it will work well. You can go back to the slide. Instructions are important. The set that I use has instructions in the box and on the box, and it really makes it wonderful because you can refer to it yourself, and you can also sell them to your patients and they can do some self-care at home, which is nice. So the shape, you can see here in the slide, the shape of these gua sha tools is very versatile. Has notches for around the jawline. These flat sides work underneath the jaw, around the temporalis, across the forehead. And then these rounded edges are really nice for stimulating acupuncture points, for kind of massaging the temples, and for working in between the eyebrows. And gua sha is wonderful for releasing any fascial adhesions, stimulating blood flow, really getting that chi moving into the face. And it's very calming and relaxing at the end of a treatment. Red light devices tend to come in two general categories. There are the tabletop ones, which are nice. You can easily just move them from room to room, and they typically have an easy setup. They're lightweight, easy to store, get them out of the way. They do have some limitations, though, over the floor models. Of course, the floor models, you can easily move them all around a patient, and depending on the size of your treatment room would determine whether or not it makes sense for you to have one of these. They usually are the same power. They come in different powers. Some of them will go as far as a pain setting. Some of them are really just for cosmetic. But when you're looking, you want to get one that has really simple controls, a built-in timer that has an automatic shut off. So if you can't get back in the room to shut the lamp off, it'll shut itself off. And it should come with some sort of eye protection. So microneedle pens are best for really aging skin, deeper scars, discoloration, also for fine lines. They're good for normal skin, combination oily skin. You certainly don't want to use it over any inflamed or pustule acne, or very sensitive skin. And it's great for stimulating collagen in the long term. Derma rollers are better for not quite as severe signs of aging, home maintenance, and again, if someone has very sensitive skin, they're probably not the best choice. You don't want to use them over active acne as well. And so more advanced signs of aging, the micro and scarring, microneedle pens, derma rollers for less. The hydro rollers are like the hydro roller and hydroneedle are just like a derma roller, but they will infuse serum right into the skin. And again, you don't want to use those with very sensitive skin. So the hydro roller, you can work quickly over a larger area, whereas with the hydro needle, it's better for spot treatments, fine lines, dark spots, just little areas. You certainly can use it all over, and you can actually take a hydro needle and put, if you have like a hair loss product that you're using, you can put it right into the hydro needle and use it for that. Facial cups are great for puffiness, tension, kind of contouring the face. Pretty good with any skin type, but you want to stay away from any broken capillaries or any active, raised, inflamed, or pustule skin conditions. Really good for enhancing the circulation, lymphatic drainage, and giving that healthy glow. The facial gua sha tools will help with any tension in the face, relaxes your patient, improves the skin texture, and it's pretty much good for any skin type except for any active wounds or infections. The red light devices, wonderful for almost every type of skin, anti-aging, redness, acne, and there are some contraindications if someone is on a medication that's sensitive to the light, and you can use it with some of the other tools, but I don't usually recommend using red light before or after microneedling, just because I like the skin, unless you're using just the white light, the blue light, to clear the bacteria. So for microneedle pens, you want to optimize your results. You want to clean the skin, disinfect the skin, adjust the depth of the needles, use good high quality serums, keep the speed and the movement consistent, and then the cartridges have got to be discarded in your sharps container every time. For the microneedle derma rollers, you want to choose the right length for your patient's particular skin. You can this should say or before or after, but you can either use a serum before or after. I guess you could do both, but if you put serum on first and then you roll, you're really going to have to be diligent about cleaning that roller, and make sure that when you're rolling, you work in multiple directions, gentle, consistent pressure, and you're going to be replacing those rollers about every as much as 6 months, depending on how often you use them. And with the hydro rollers and the hydro needles, you're going to want to use good quality serum, and pretty much the same as the derma rollers. You're going to work in sections. You don't want to press too hard. And if you're doing a deeper treatment, you don't want to treat more than every 2 to 4 weeks. So kind of the same thing with the hydro needles. And you do want to keep them clean. You clean the head of the device after you use it. With the cups, make sure you're using a high quality oil. Be careful not to use too much suction. You're going to follow the lymphatic system, and you can do cupping as much as 3 times a week, and you want to choose the right cup size for the person's face. With the gua sha tools, again, make sure there's good high quality oil and use proper techniques. You're going to be doing more of an upward and outward movement, and you can work on different acupuncture points. I always tell my students, you can go for the gua, but not the sha. Um, and red light devices, you're going to choose the right wavelength depending on your patient. Make sure their skin doesn't have any product on it, and you can use it as 3 to 5 times a week um, uh, for the best effectiveness. Bringing this all together, um, you really want to tailor combinations of treatments depending on your patient. Um, you can layer your treatments, so you could do some derma rolling and then some red light. What I do is I sit down with my patient and I am going to adjust my treatment plan depending on their needs. I might do facial acupuncture and put the red light over it. I always do cupping and gua sha after a facial acupuncture treatment, and I educate my patient about what it is I'm going to be doing. And a lot of these tools, not the microneedle pen, a lot of these other tools you can sell to your patients for at-home care in between treatments, and make sure that you take before pictures and really track their progress. Speak to them about their goals ahead of time, and then check in with them and see how they're doing. Again, my name's Michelle Gellis. If you would like to reach me, you can go to my website, facialacupunctureclasses.com. You can learn about my classes and any of the products that I spoke about today. And you can also find me on social media under my name. And I want to thank the American Acupuncture Council for this opportunity today.